Great. I think all of us are here now. Do- Dr. Samaniego also joined. So let's start the day, guys, so that we are on time and we'll have a great time discussing about today's panel discussion. So good morning, good afternoon, and good evening to everyone from all parts of the world who have registered for this great webinar happening today. Hope you and your family are doing safe in the COVID times. Our best wishes are with all of you. Now, to begin with, let me introduce myself and the company to all of you. My name is Nitin Naveen, and I'll be your host for the day. I'm working as Vice President Innovation and Strategy at AI CoreSpot. Further, I have been joined by my colleague Arvind and Naveen, who will also assist me in keeping the event lively and resolving technical glitches if it comes in between. So, thanks a lot to them for putting in hard work and making this one a huge success. We'll try to provide a seamless experience to all of you so that you can gain maximum output out of the same. Let me provide a brief background to all of you about AI Core Spot. We started last year, backed up by Infovision, who is our technology innovation partner, and Digit7, who is our technology partner. The focus is to provide all of you a deep dive in all the sectors where technology is there, and every month the theme is different. Also, we are gaining momentum month on month. Our aim is to be number one AI driven community all over the world so that like minded people like you can be part of the same in supporting, growing, and making it a success. Our mission is to serve as a hub for information regarding Industry 4.0 technologies, which includes AI, ML, deep learning, digital twin, robotics, IoT, AR, VR, blockchain, 5G, drone, analytics, edge AI, edge computing, cloud, and so on. We'll enrich the content through a lot of different mediums what we have like digital content, videos, blogs, newsletters, podcasts to shed light on the ever evolving industry. The focus is to do industry backed webinars and hybrid events. The knowledge base will be made from reliable data through subject matter experts, thought leaders, industry leaders, and our partners, which is Infovision and Digit7. Today, we are having a lovely and unique webinar around the great theme, which covers how technology is transforming patient experience. So, if anyone wants to know how digitalization, and digital transformation is transforming patient care, how technologies are re-architecting for enhancing patient experience and customer journey, and so on, then you are in the right place. We'll go all over it throughout the panel discussion and give lots of insights to you. There are lots more in store for this month as well as subsequent months with focus on banking, financial, insurance, telecom, retail, healthcare, supply chain, energy, utility, manufacturing, and so on. So request all of you to go through our website, which is aicorespot.io for future updates. Also, please like our social media handles, which will keep you all updated on everything what we propose to offer in the coming months to follow. Before starting with the day, I would like to highlight few things so that it can set up the tone for the amazing learning and networking day. Special mention about our knowledge and innovation partner, which is Infovision. It is an end-to-end IT and business services provider specializing in providing technology transformation and innovation projects for over 25 years across multiple industries. They have over 3,000 technology professionals working across 12 global locations, which includes US, Latin America, Middle East, and India. They serve over 65 customers across banking, financial industry, telecom, media, retail, consumer goods, healthcare, and manufacturing industries. The core services which they offer includes digital engineering services comprising of big data analytics, cloud, DevOps, application services, legacy modernization, digital quality assurance, mobile API, microservices, social media research analysis, and cybersecurity. They have also opened a unique state-of-the-art research and innovation lab named Digit7 last year in Richardson, Texas, with five great products, which includes dgrab, Napcart, Tag Square, Digit Shelves, and FlyRobo. The beauty about all the five products is that they are customizable, cost-effective, and can be used in every industry where technology is needed. With their strong technology capabilities and delivery expertise, we are sure that they can help anyone in their transformation journey and provide technology needs that can build future-proof business model and excellence into one's and customer experience. So to get in touch with them, kindly log on to their website, which is infovision.com, and leave your details through the contact us section. Now, coming on and moving to our community partners for today, it includes a couple of great companies, which is Team Health Midwest and BJC Healthcare, who came together to make this webinar a success. Special mention to attendees of the event who registered and came today to achieve their objectives through this forum. At the end of the day, if you gain few things out of this or get to network with each other, then our core objective as a platform will be achieved. Further, if anybody wants to ask questions, they can type it in the Q&A section, which is there at the right corner of the menu option. You can type in as when the panel member speaks, and we'll try to get it answered as per the time permitted. There's also a hand button at the bottom of the screen through which you can even raise the hand and come to the stage to ask questions to the speakers as well. Now, let's begin the show. Let me hand over the stage to Datta, who is the Chief Business Officer handling healthcare, life sciences, and manufacturing from Infovision, who is the moderator for this panel discussion as well. He's joined by Mark, who is Vice President, Global Healthcare Innovation and Strategy at Infovision. Then we have Dr. Samaniego, Physician Vice President, Practice Development at Team Health Midwest, and Jennifer, who is Patient Experience Officer at BJC Healthcare. So over to you, Datta, to begin this exciting panel discussion.
Thank you. Thanks, Nitin and Arvind. Thanks for arranging for this. Good morning to all of you, and good morning to the audience as well. So we have a great topic today on patient experience. See, many believe there is no such thing as a perfect healthcare. That may be true, I believe in it. However, if you improve patient experience, this can create the perfect patient result that once achieved can impact the business, patient, and staff in profound ways. The perfect patient result can be achieved independent of the patient outcome. Of course, all of us look for desired outcome, but sometimes that's not possible. So how do you really get the perfect patient result regardless? So it requires contributions from both clinical and non-clinical personnel, including those who don't have direct patient interaction. As they say, it takes an army. Here we aim to uncover a patient's experience, patient's perspective on who, what, and then how to improve patient experience and achieve the perfect patient healthcare result. So imagine achieving the following results for every patient or a patient family, independent of the patient outcome. Our experience was great. We are going back to the same facility for our future healthcare needs, or we are recommending this to others. See, not only basically I have witnessed firsthand these results being achieved, even amid the worst of the outcomes, right? Patient experience is a key success driver of healthcare systems. With evolving patient expectations and the disruptions due to the COVID-19, technology and digitizations have been enablers for the change. But tools are not enough. Humanity in healthcare is needed to help engage employees, shape work culture, and also to envision the patient as the why for each step towards the change. These factors together will help to provide the highest quality of care while reducing the cost and inefficiencies as much as possible. Right? So, in order to discuss on this topic, fortunately today we have a great panel speakers, Dr. Samaniego, Jennifer, and Mark, who have extensive experience in the field of healthcare, patient experience, and also they have been practitioners helping implement some of these technologies and in the middle of this revolution. So we will deep dive into specific areas once we have introductions for them and then get started. Just for the audience, we seek your participation in order to keep it interactive. So we'll answer the questions at the end of each topic, and also if there is anything remaining, we'll answer in the end. So over to you, Dr. Samaniego, for your introduction.
Yes, hi, Loretta Samaniego. I'm an emergency physician, and I'm the Virtual Care Business Development VP for telehealth. Happy to be here. Thank you for having me. Just a little background on virtual care and how we believe virtual care is transforming the patient experience. As you know, virtual care, telehealth grew out of the pandemic, became a huge way for patients to be seen at that time. And so we really are reaching out to patients now virtually in multiple modalities, from the beginning of healthcare with urgent care and ED visit, through hospitalization and inpatient care, through the post-acute, and then the hospital at home. And in all of these areas, we'd like to tie that together with virtual care. We talk about the pandemic, the COVID pandemic. One of the biggest pandemics I think that exists in healthcare today is the nursing shortage. Not anybody who works in healthcare hasn't been affected by that. We all know that we're looking for different ways to extend services related to the nursing shortage. Virtual care, particularly telemedicine, is one of the ways that we can limit resource use. We have, for instance, our virtual care platform. As a physician, we give direct care to the patients. We do the intake, we do the evaluation, the medical record reconciliation, if you will, and then the care to the patient and discharge instructions. So limiting, again, resources, nursing especially. It's 24/7, 365. Access is really key today, and patients are wanting to get care when they want it and how they want it. So I think telemedicine is huge in providing that patient satisfaction bridge for them to get all of the care.
Thank you, Dr. Jennifer. We'll go with a quick introduction and
Sure. So my name is Jennifer Karen. I am the Patient Experience Officer for BJC Healthcare, headquartered in St. Louis, Missouri. And I'm going to piggyback off what Loretta shared. Our biggest issue, and I think one that all healthcare organizations are facing, is the dire worker shortage and increase in demand. McKinsey & Company recently published an article in May citing that 29% of responding RNs in the U.S. were likely to leave their current role and noted their intent to leave the workforce entirely. As of February, 90% of McKinsey respondents said workforce shortages were a barrier to increasing elective surgery volume, and this is up 11 points from 2021. That's quite a few months ago, and I would guess that numbers are even higher today. So workforce is leaving, and we have increase in volumes unlike anything that we've seen, at least in my lifetime. Currently, with a spike in RSV, we're on the edge of what we're calling a tridemic, which includes RSV, COVID, and flu. So with our high volumes and record numbers, our staff is out sick too for the same reasons that we're seeing an increase in volumes. So the situation is uncertain in many areas. And this is one of the things that our BJC digital team is working on right now. Using human-centered design practices, cross-functional collaboration, and production teams, they are co-designing in partnership with our teams and our patients a better way to deliver care. Looking at the journey from when the patient, first thinks that they need a provider and they take to the search engine, all the way through when they pay their final bill and keeping in contact with the patient outside of the episode of care. All of it is within our focus. So what this looks like is a digital solution that takes the burden off the workforce and can predict patient needs, helping them navigate our complex system. Throughout the journey, we're creating a technology-enhanced ecosystem that is personal, predictive, and responsive. Examples of this are the CRM, digital wearable devices, while the patient's in the hospital, detecting vital signs and sending those signals and alerts directly to the care team caring for them. Smart beds with Bluetooth and reminding the nurse to plug it in. In addition, we need to attract growth-minded workforce to include students and new grads. We're fortunate enough to have nursing and medical school as integral partners of part of our academic medical system. So providing an ecosystem where students can work and grow in one of the most advanced, technically enhanced, and innovative medical care settings is very attractive to the brilliant minds that we are continuing to fuel our future innovation. So it's a challenge. It's in front of us all, but we're trying to chip away at it one step at a time.
Thank you, Jennifer. Mark?
Thank you, Donna. Thank you for the time today. My name is Mark Johnston. I am the Vice President of Innovation and Strategy for InfoVision, as discussed earlier in the introduction piece. We're focused on that back end piece to allow a lot of things that we're going to talk about today in consumerism, which is driving. It's a buzzword. We all talk about it. Healthcare needs to become the Domino's. Domino's can deliver a pizza anywhere in the world. They can take an order. They can customize it by an app, a phone, website. That can be delivered in the middle of Africa by a drone. That might be a dramatic analogy there, but I think we really need to get our heads around what consumerism means. I think also to carry on a little bit on that discussion that popped up on staffing shortages, we all understand that. Not only do we have staffing shortages based upon pandemic stress levels that went through our staff, but the impact of an aging demographic on the entire healthcare ecosystem is going to require automation to innovate. There's no easy way to get there. We can't create more nurses. We can't create more doctors. We're trying to improve that flow. At the same time, the only way that we're going to meet the demand on healthcare, if you look at the demographics, at least in the United States and the aging, the fallout from providers because of retirements, is to employ innovation through robotic process automation, AI and ML. That's the only way we're going to solve the staffing issues in healthcare today, because it's going to overwhelm us as we move forward. All you got to do is look at the data. So I appreciate the opportunity to be able to speak here today and with my colleagues and look forward to the discussion. Thanks, Donna.
Thank you, Mark. So let's get a poll question up, Arvind, if you can, so that we'll get the perspectives of the audience as well in terms of what do they think as the number one issue in the healthcare delivery organizations, what we are seeing.
Yes, the poll is visible in the poll section. So we'll wait for 10 seconds to audience to respond to this.
Okay. Yeah, I can see now. I think there was some amount of delay, I think. But yeah.
So 67% says shortage and inefficiency, and 33% say all of the above.
Great, thank you. See, I think it is coming out very clearly. I think it was articulated in the beginning as well. But so let me ask this question to Mark. Do you really see that during the COVID, the increase in the usage of the telemedicine, is it still actually keeping the way it is, or what is your perspective on that?
Well, the headline, I think, and the data shows the truth that it's declined dramatically. But I think, again, you got to look at during the pandemic, for the majority of those who were seeking care, telehealth was the safest modality. And of course, you'd expect to see record usage. I mean, if you look back in March of 2020 and look at those numbers, people were afraid to visit the traditional office. So you're going to have a back off. Once people felt that life was returning, to pre-pandemic norms, you would expect that we would revert to pre-pandemic modalities, especially like with urgent care and PCP settings. Demographic usage shows that about 27% decline were amongst those 65 and older, while the demographic actually increased, and behavioral health continues to take hold in telehealth. But telehealth's nothing new. It's been around since the 40s when we transmitted radiology images across phone lines. So it's just another tool in the virtual care toolbox to allow greater access. It's going to expand. It's not going away. But we really need to focus on meeting the consumer. I want to call them patients and not consumers. Meeting the patient where they are with the modality they prefer in a very hyper-personalized message that takes in their preference and their personality. So it's here to stay. But I think if you're going to grade it against the numbers at the height of the pandemic, that's kind of an unfair position to take. It's here to stay, but it's just another tool. We can't look at it more than that. It's going to be part of a greater tool set. So it's not waning. It's going to continue. The numbers are down simply because you're looking at those numbers compared to pandemic highs when everyone was afraid, unless they were deathly ill, to go into an ER or to even see their PCP. So I think that explains where we're at today, but I see it continuing on.
Thanks, Mark. So, Doctor, since you are basically in the middle of this, what is your perspective? Are you also seeing that it's more of basically convenience, or people are trying to adapt, or is there a technological issue through which they are not able to really adapt to the levels what they are looking for? Because everybody is getting influenced with the usage of the phone or basically the iPads, where in the other industry it is very seamless. See, everybody wants either the Tesla or the Amazon's experience, right? In terms of what they get, it may or may not be very close to what they can aim for in the healthcare yet. So, what's your basically perspective on that?
Yeah, my perspective and our experience actually with the telehealth platform is that it's a real patient satisfier. We rolled out telehealth at Team Health almost 2 years ago. We started out with our own, so we give it to our employees. And the feedback that we get is very, very positive. A lot of return visits because they enjoy it so much. As a physician, and for all the clinicians in the audience, that as soon as your family members know that you're a clinician, you start getting those calls. Oh, my son has a cold. My daughter broke her finger. And having a clinician in the family is great. In my opinion, telehealth is kind of like having a clinician in the family. You can call anytime. You can jump on at 3:00 in the morning. You can ask questions. We have a texting platform that they can even follow up and ask a few questions afterwards. So what's better than having, the second best thing to having a doctor in the family is telehealth. It's available when and where you want it. So we are seeing that both with our employees that are using our telehealth, as well as, our non-employees, hospital partners, patients, and hospital employees, really finding a lot of satisfaction with it. I think there's some key factors to get that satisfaction. You have to provide training for clinicians to provide care in a telehealth platform. Seeing patients face-to-face is not the same thing as seeing them like we're seeing each other right now. So you have to be trained to do that. And it does take a specific skill set in order to give quality care in telemedicine. So I think that's part of it. And there has to be a high emphasis, again, on patient satisfaction and how to complete a visit in a way that gives the patient satisfaction, gives them follow-up, gives follow-up to the primary care physician so that you're closing the loop with the primaries, because they're such an important part of healthcare. And again, a shortage of primary care physicians in this country. So we need to support them as well through telemedicine. So I think that, it's very much of an advantage to the patient. With respect to technology, we are starting to, I think a big concern in the beginning was if perhaps the older generation wouldn't be as savvy with technology. But I think we're all starting to see this, with our parents who got their iPhones and they're texting us and doing all kinds of fancy technological things. It's become a part of daily life. And so we actually are seeing a lot of reach out from the older population who is enjoying, again, not having to get in the car, drive someplace, find a parking spot, get exposed to somebody with COVID or pneumonia or the flu or whatever. There's a big satisfier for all populations. And again, the working population, you wake up 5:00 in the morning, you've got a sore throat and a fever. You don't want to have to miss a day of work for that. So hop on your telemedicine visit and find out what you do and get on with your day. Great satisfier, in my opinion.
Thanks, doctor. So, Jennifer, you're in the middle of the patient experience. So, what is the feedback you are getting basically on the ground? And then you must be collecting some statistics based on the collected data. So, what do you actually see from the data which is being collected, and what is the signals you are getting from the patient experience point of view?
What are the signals that I'm getting?
Yeah, basically from the data which is being collected and being analyzed. So from the patient experience angle, so what is the what is the insights you are getting?
Yeah, so Loretta spoke a lot about the pandemic. So the feedback that we're getting from the patients is changing, and national trends show that patient experience scores are going down. This was the first year that we actually had lower benchmarks for HCAHPS based upon last year's performance. So what we're hearing from the patient is that they want to be connected. They want to be in connection with their healthcare organization. I often refer to it as a friendship, not a marriage, because with the marriage, you're sometimes can be nagging to do household things, and with the friendship, it's a gentle reminder. And so, patients want a relationship that is with the healthcare entity that is there when they need them, much as, is talked about in the virtual care piece of it. But also they want to be connected to a system that knows and recognizes them. So, we're seeing in the data that the trends were starting to get those numbers back up. But again, long waits, access in outpatient setting, access is one of the number one key drivers. And so just getting access to a healthcare provider can be challenging during these times. So for organizations that do have a partnership with the virtual care solution, they're seeing a lot of benefits there.
Thank you. So let's go to the next topic. Probably I think we'll get the whole questions all up, Arvind. So we will talk about, I think there is as I can understand from the speakers, that there is a general acceptance to the virtual care, telemedicine, but let's also see probably what are the main barriers for adopting it as well. So yeah, okay, we have got the second one up. Let's give 20 seconds to get the responses, and then we'll kind of deep dive into that.
So 50% say all of the above, 17% says electronic health records, another 17% says understanding digital medical terminology, and 17% says access.
Okay. Thank you. So, Doctor, from your perspective, I think Mark brought up the point that it is in general, the virtual care or the telemedicine, the usage has declined, but that is comparing to the peaks of the COVID times. But it has been more than almost a year now that we have come out of it. So in terms of the acceptability or the usage, do you see any challenges which patients want to come to basically in person, or they would like to basically embrace the telemedicine?
Yeah, I think that patients, want to have the least resistance, like we all do, to getting from point A to point B. Obviously, I think that digital technology is evolving, and I think it's evolving rapidly. And so getting access has changed and continues to change. If it takes too many pages for a patient to get to that visit, they're going to hang up. That's the reality of it. And if they're trying to get into their primary care physician and there's too many, steps to it, too many phone calls to get onto the digital platform, they're going to abandon the visit. So we have, I think our biggest challenge is in that first part. It's getting to the visit and developing a user-friendly platform and technological pathway for patients to get there, I think is key. One of the things that we actually have on our platform is we have what we call a client success specialist, who is an actual real life person and who's available, so that if the patient runs into some of those technological issues, They can click on the button and get to the client success specialist, like if they're having trouble with registration or, whatever it might be, those technical issues, to be able to talk to a real life person. We know how rare that is today. So I think that that's one of the ways that we can help patients as we continue to evolve the technology. We're also, there's a lot of technology involving supplementary evaluation tools for telehealth, the home otoscope, the cardiac monitor, the pulse oximeter, the vital signs taker. All of those things are also great supports for telehealth visits. How do we get those to the patients? How do we pay for them? And how do the patients learn how to use them? Putting an otoscope in your ear is not just, a simple solution to looking at the eardrum. It has to be done correctly. How do we get those tools to our patients? Those pulse oximeters are great for evaluating patients post-COVID, but now look at pneumonia, CHF, COPD, a lot of these lung diseases. If we could get those tools into our patients' hands and help them get some additional information for us in the telehealth visit, I think that's going to be the next step. So a lot of opportunity, a lot of development. Everybody's coming up with a new tool every day. I think these types of tools are going to continue to help us give really good care to our patients from home or work or in their car or wherever they happen to be.
Thanks, Doctor. So, Jennifer, I think this leads to the next probably segue to, there are so many gadgets, so many sensors from so many different companies, and every day it is evolving. So how do you think the patients are taking it, and also how actually the whole of the healthcare itself is trying to adapt, and is it really going fast enough to basically cater to the needs of the patient in order to serve it?
Yeah, I think that depends upon which organization and how advanced they are at including the patient in the development of those strategies. Loretta mentioned the at-home otoscope. That would be a game changer it would have been for me as a mom with two boys who got ear infections all the time, or, nurses in schools. I could about imagine how much time that would save and stress on kiddos who have to go into the doctor's office. But it's moving quickly as a healthcare organization. I mean, we are tapped numerous times every day with the new technology that's out there. We've set up our own digital department to help us move it forward in a streamlined manner and getting all of the systems to talk together. We all have to be rowing in the same direction, and having the patient at the center of it. Building your patient and family advisory council is step one. Step two is making sure that they are in co-design so that we're building with empathy and compassion. That'll move us a lot further and head in the right direction.
Thanks, Jennifer. So, Mark, see, all these different technologies are already available in different other industries. For example, for payment, we just use the QR code. Or in airlines, we just use the QR code and just check in. And especially in the banking and then the retail, if you take Amazon Go, so what do you think are basically the constraints for bringing those technologies to the healthcare? Why there is so much of resistance?
Well, I think, I'll kind of start with digital friction points for patients. A lot of times, providers, and I think the community is doing a lot to get to where they need to be, but they tend to overestimate their performance with the consumer. About 81% of consumers are dissatisfied with their engagement at this point. That's not a really high rating. So there's a lot of room to improve there. They're frustrated with having to provide the personal information over and over again. And as you know, as you mentioned, banking in Europe, you can use an app on your phone to be identified and be engaged across mortgage lending, banking, and avoid those security concerns. So it's very fluid. It's very flexible. I think the healthcare industry needs to get there, but it needs to be very personalized in healthcare. got to keep in mind that the average fluency or language needs to be at about a fourth grade level. 90% of the country don't work in healthcare, so they may not understand terminology. So we need to craft, and I think a lot of people are doing that today. A lot of hospital systems are doing that effectively today. The payers are already using AI chatbots along with instant access to a human being, but they're able to build upon as they learn and communicate with that patient the way they want to be communicated, the cadence, even down to the personality nuances are down. That's going to make it more fluid for the patient to access and build that journey. It depends where you are in your journey. Typically, if you're healthy and you're not utilizing healthcare, you don't want a rash of information you might be hit with that's not specific to you. People want to hit only the information that's specific at the time for them in the place they choose. So you need to craft those messages very personalized. If you've got a chronic condition, obviously you're going to be in that journey and want a handheld and feel you have that personal relationship with the physician. That's all being done today. But we're kind of at the infancy of doing that. I think healthcare really needs to look from the patient inward and not from the provider side of it as much. To take a look at what other industries have done. You brought up banking, finance, retail. There's a lot of lessons learned, I think, in digital transformation that can be applied to make it more seamless. Certainly, you got to take the friction out of it. Everybody I know is looking at doing that through different methodologies. But we got to keep the patient in mind. What's most important to the patient versus what's most important to the patient and the provider. And we got to keep the provider and their staff in mind with their workflows, not to exacerbate those or make them more complicated or cumbersome. But I think patients are willing to engage. They're willing to take on some of that admin burden if you make it fun. I hate to use that word fun with admin, but people are doing it through gamification and different things, but that's how we're going to get there. But there's a lot of friction right now in healthcare. There's a lot of noise. There's multiple messages coming from multiple different areas that they're getting hit with. And they also want to know who they're dealing with. They can discuss their medical concerns with via text or via on a phone. Security is still a major issue with most people in the country today. When they're sharing something as intimate and personal as their medical condition. So it's a big target.
Thanks, Mark. But since already there are this probably a question to doctor. So see, not only telemedicine, I think including basically training the clinicians and also the staff in terms of the better caregiving right from the day one, as well as engaging them in the various adaptation of the tool. There are a lot of techniques like augmented reality, virtual reality, and those kind of things which are available. So do you see the adaptation happening the way it needs to be?
You mean the adaptation to telemedicine?
Not telemedicine. See, telemedicine is one aspect of it, but for training all the clinicians in terms of usage of some of these tools, as well as basically training them virtually. So there is already the technology which is available, and it is in nascent stages and it is in silos. But how do you see basically it is being adapted? Basically, for example, in the facilities where you are working, is there any hindrance to basically adapting them, or what is the kind of interest what you are seeing?
Yeah, well, I think that anything that is technology for the younger generation is enjoyable to them. We find that the young residents that are coming out are using so much technology to take care of patients. Even some of the technology that may have existed 20 or 30 years ago, for instance, the ultrasound machine, is used in so many different ways today that we could have never even imagined back then. And so we've got existing technology that's advancing. We have new technology, and all of those are very attractive to the physicians who are coming out of training these days. Any tool that they can use to make a diagnosis better, faster, stronger, more correct, they're gonna embrace these. And training has also embraced technology. We have specific rotations built around technology that we didn't have 20 years ago. So the use of technology is helping healthcare, and the young clinicians that are coming out of training now are embracing that because they want as many tools as they can to take care of patients in the best way that they can. As you know, the knowledge in healthcare also has exploded, and so any technology that can help them to garner that technology, that knowledge of healthcare, also is very useful to them. So there are multiple apps, for instance, on the phones that we use nowadays to calculate, different parameters in medicine. There isn't a single practicing emergency physician who doesn't have at least 10 apps on their phone that are related to their daily practice. And so all of this technology is really helping to garner. There's so much knowledge out there. We have to be able to put it somewhere, and be able to access it quickly, especially, for instance, in emergency medicine. You don't have time to look things up. It's got to be right there. All of those tools are very attractive to clinicians coming out of training now.
Thanks, Doctor. So, Jennifer, when from the patient's perspective, because there are so many tools and then techniques which are available, do you see the patients have the right technology to basically embrace? For example, if they have to be trained for using some of these different instruments for doing self-evaluation before they go to basically the clinicians or even to the telemedicine, or if it is basically the post-hospitalization, there is something which they need to be keep on monitoring on a regular basis. Do you think there is an adequate training which is being, the tools being adapted to train basically the patients? And what is basically the feedback which you are seeing on the ground?
Yeah, I think it varies by having the financial resources to get access to those technologies. I mean, when we think about healthcare disparities, it is as we get more technology in our space and expect our patients and consumers to use this technology, the wedge of disparities is widening. I really think, and I agree with what Mark was saying with friction, and going back to your original question with the QR code, it's a great example. I mean, we would assume that everyone would have a smartphone now. So what do we do when we have homeless that come in and they don't have a smartphone? And we're designed to provide a solution through a QR code. So we really need to approach our digital solutions through applying a bias lens to all things care delivery. There's so much unconscious bias that we have built in. Just one example of it is interpreter services. When you look across the healthcare industry, access to the interpreter is usually put in the hands of the care team. So when a patient comes in and they want to communicate with us, we as clinicians have to recognize that they want to communicate. Why do we set it up that way? If we apply a bias lens, we would give our patients access to a digital interpreter and the digital means to make it happen from the point of entry. And that's really what we're focusing on here. That's just one example of how we're applying the bias lens to all things digital, so that we can help our community and patients overcome that disparate technology right now.
Thank you. Thanks, Jennifer. So, Arvind, if you can bring up the third poll question. So how many more minutes? 15 more minutes, right? I just want to make sure that
Yes.
we are keeping on time.
So the third poll is live.
Poll is up.
So
Okay.
we'll wait for 15 seconds. So 50% say all of the above, 17% say transparent and ignored, and 17% says driven by data and technology, and 17% say patient centered.
Great, thank you. So probably I think this will lead to the next question in terms of basically what does the future look like in terms of how things are evolving. So probably I think we'll go with you, Jennifer. So what is that your company is trying to do, or basically your peers, in terms of advancing this, or in terms of giving a better adaptability to the patients, as well as actually on the other side to basically improve the overall patient experience?
Yeah, I can't say enough about our digital team and technology team and then the partners across the industry that they've been working with to improve healthcare delivery. We have a lot of things that we're working on here. Our list is long, but one thing I'm really excited about that's really disrupting care delivery is at the bedside access to technology. So I would ask everybody on the call, what's the one thing that every patient in every hospital, every emergency room, and every ICU does every single day? And the answer is they wait. They wait to be called to a room. They wait for a bed. They wait for a meal. They wait for test results or even to go get the test. They wait for the nurse. The list is endless. And so what we're really focusing on is paying attention to how the patient waits and giving them access to technology so they can choose how to spend their time. So we are bringing a patient engagement system to every bedside. And through this bedside tablet, they'll be able to access streaming technologies, games, videos, calming content. I mean, most of our EDs are set up, the environment is set up for escalation. I mean, if you could imagine going into an ED and you're waiting for hours, and really the only thing the only way to spend your time is either your own digital technology, your phone, or watching everybody else. And so by watching others who sit there, I mean, the tempo, the environment just escalates. And so the calming content allows them to choose, different apps or videos or meditation to help them de-escalate. The other thing that we're doing is giving them access to their health record. Research shows that with giving patients access to their digital health information, it creates an engagement and patient ownership over their health care. And so at the bedside, they'll have access to their plan of care for the day, their care team. We can push educational patient content in multi-mode directly to the patient and write it back to the electronic health record. So circling back around to our original conversation about what's one of the biggest challenges in healthcare, and we all said workforce. And so this is with the right backs to Epic and the solutions that we're providing at the bedside, it's actually taking those tasks away from our clinical teams. And then the other thing is our diverse patients and health equity, again, is a big concern of ours. So we're designing it in a way that patients can access their health care while in our care, but also at home so they can continue that journey of improving their health. And then the last thing that I mentioned interpreter services. So it's loaded on all the devices and at the touch of a button, a patient can bring in interpreter services into the room. And it's Android based. So it's virtually, we can load any app out there. And we're actively working on this project. I have a lot of interest from other patient experience leaders across the US because it's the one piece of the visit that we often don't consider. And it's every patient does it all day long. They wait.
Thanks, Jennifer. So, Doctor, a question to you. See, basically, on the bedside, irrespective of the condition of the patient, do you see acceptance of the robots going forward? Because the robo usage has increased in hotels, in restaurants, not only basically for serving, even for cooking, right? It has become totally autonomous. So since the nurses and then the bedside, basically the care is reducing because of the people availability, Do you see the adaptation of the robotics alongside basically the patients on the bedside increasing? Or if not, why not?
I think that this all goes back to exactly what Jennifer was talking about, and it's waiting. And, you look at all the queuing theory that goes around the waiting and throughput, and it is the biggest dissatisfier and yet the biggest part of healthcare, exactly like Jennifer said. And so we have to find ways to decrease weight, and we all work on that through operational devices and implementations and technology, etc. But there's always going to be weight because there's always more patients than there are providers of all the different key components of healthcare, whether you're getting a lab or an x-ray, seeing a doctor, seeing a nurse, whatever, there's always going to be weight. And I think that anything that can help to, like Jennifer said, again, de-escalate what is naturally an anxiety producing time. You're sick, you don't feel good, you're waiting, you're thinking about it, you're looking at other people that are sick. It's a natural anxiety producing time. Anything that can help to de-escalate that anxiety is going to be welcomed by patients, whether consciously or subconsciously. Distracting them, helping them, interact with some kind of technology. They may not, think that that's what they want, but it's helping them to not think about their illness, their pain, their anxiety, their fear, right? All patients have fear, and we have to really understand that that is a key part of taking care of patients, is addressing their fear. So I think that that's key. One of the other things that I just wanted to mention that I think is a real area for us to address, and one of the things that we've recently looked at is the follow-up from the emergency department. A lot of patients are worried about what's going to happen when I leave here. Because we all know the ER visit, and then you leave, and then what? And then who's going to take care of me, and how am I going to see somebody? And that's one of our recent technologies that we are trying to fill in the gap, is following up patients from the emergency department. Because again, with the clinician shortage and the nursing shortage, getting in to see your PCP, it can be very challenging in a short period of time that's required from follow-up in the emergency department. So providing a virtual care after the emergency department visit. Did you understand your medication? How are you responding to that new antibiotic they started you on 48 hours ago? Are you getting better? Are you getting worse? All of that period after the ER is really critical for patients. And it's a time where they go home, and here you are in the ER, you have all these people paying attention to you, and then you go home, you're all alone, and your mind is swimming with all the information that you were given. It's important to be able to reach out to patients during that time and give them access to providers. And I think that, that's a key area that we've missed in healthcare. So we have an ED follow-up virtual care visit now that provides patients access to our clinicians 24/7 after their ER visit. And so I think that's key. Another way that technology is helping patients with their anxiety, their fear, and helping to increase patient experience.
Thanks, Doctor. So, Mark, I think I wanted to touch upon two topics. One is on the interoperability, and then the risks which are basically associated with it, as well as basically on the transparency, right? I think these are the two key topics which are coming up again and again. So, your thoughts?
Well, I think a lot of what we talked about today and building that patient journey digitally is all going to be based upon data. And there's certainly a lot of it. And I think it was mentioned in the call too, and you mentioned, Dada, that patients having multiple apps, there might be 300,000 points of connection out there. That's some security risk. That's a lot of inputs and outputs. The good news is, I think we're at a watershed moment in the United States with the interoperability and information blocking rule, which now it's going to basically allow consumers to aggregate their health data into a longitudinal view with third-party apps. So with the development of APIs, the ability to access, real-time patient data from medical records, from payers, providers, all those wearables, all those sensors, they're going to move as far beyond the silos that have stalled innovation up to this point in healthcare. It's the real deal breaker. Now, how fast will we move there? Well, it's not going to happen overnight. We need at the very top of organizations to change the way people thought about sharing information, because it's been in certain organizations within healthcare looked as a competitive advantage. So we need to change the way we think about it, but it's a real game changer to move to the next level of innovation. And of course, it's got challenges. The amount of different types of inconsistent information coming across multiple sources, right? Validating requests for patient information. That's going to be the need for AI and NLP to be able to extract that relevant information and make it actionable. I mean, we all talk data, but it's got to be actionable. You know, the risk-bearing organizations like the ACOs, they're going to want real-time data from acute care services. So we're moving into a really exciting area. I hope we move there faster. You know, fear is going to help us get there too. There's been a little bit of a lack of support in two-way data. Most fear apps, you know, kind of pull data out, but the ability to write data back is kind of limited. So I think, you know, there's some negatives there, but the good news is I think organizationally, regulatory-wise, we've set the framework for put the patient in the center of their healthcare, and that's going to be through the use of data, and that affects everyone: the payers, the patient, the providers. We're all going to be involved in that, you know. And InfoVision's at the forefront of helping on the backside create that to be a reality for healthcare systems. But I'm excited about it because this is finally a chance where we break out of some of the silos to be able to utilize that data. So yes, there's risk. Obviously, as I said, with managing inconsistent information coming across multiple sources, I think a higher risk is the lack of movement at the top of leadership in certain organizations to move that industry forward and get their buy-in, because you've got to have buy-in at the very top. Plus, these healthcare organizations have been stressed out with COVID-19. There's a lot of challenging priorities within these organizations. Staffing, as we presented, is a huge one. Costs have gone up for healthcare hospital systems during COVID, having to employ travel nurses, all the other labor constraints. So, you know, they're challenged. Their budgets are challenged. Their profits have been challenged, believe it or not. And, you know, there's challenges, but we're getting there. I think that's the good news. And I think, you know, interoperability data is the deal breaker. It's the watershed. But we're not going to get there tomorrow. But at least the framework has been set. And I think we're moving towards, you know, standards that will allow us to access and make that data more actionable and more useful to the consumer. Because I mean, how much healthcare consumer does a consumer want to consume, if you will? You know, they're inundated. It's really going to be hyper personalized depending on that consumer, and build that relationship with the provider. It was earlier mentioned about, you know, pre-op, post-op, inpatient, rehab. There's systems today doing fantastic things through AI, using chatbots that actually provide the patient the feeling, even though it's not human, personal to personal, that they're feeling the doctor or the provider is watching them through the entire process. Their pre-op instructions are given to them. Their nudges along the way to see how their rehab's going, how's their medication, what's their pain levels. I mean, all these little nudges are part of that care journey that build that trust with the patient, make them feel like they're not alone in that journey. It's scary for those who've never been through, you know, a surgery, let's say. But I think we're doing some tremendous things to build that confidence with, you know, the staffing issues that we have. So I'm excited about it. I know there's challenges to it. There's risk involved in it, but I think the direction's been set from ONC to where we're headed. And I think we're going to get there. Over the next few years, you'll see a big change in consumerism in healthcare for the positive.
Thanks, Mark. I think there are two questions from the audience. So let me read it out, and any one of you can take it. What is the key to making value-based care models successful? That is one. And the second one is, do patients really need telemedicine? What are the new technology around that?
I'd be happy to start with the first one, with value-based care. You know, value-based care is another buzzword. You really got to look at how incentives are aligned with institutions or organizations. You know, some hospital systems are, if you look at the structure and how they're incentivized and how they're paid, value-based care in that setting, it's not as aligned in the incentives as in the primary care setting. So definitely we're moving into the value-based care world. We're seeing success in the primary care setting, tremendous success there. But I think we got to get our incentives aligned there. I also think, tying this back into data, that real-time data and access to data is going to help with population health, social determinants of health, to get a good handle on risk. And that's what these organizations are all in charge of managing. Is it comes down to risk, and how do you manage risk successfully? So we've got a ways to go. I think certainly in the primary care areas, it's already taking off. It's already showing success. We just need to get the incentives aligned to make it work in the hospital systems for the majority of us. That would be my comment.
I agree with that, Mark. I would also say that fundamentally, yes, it is good for population health and our patients, but it needs to be a fundamental approach by the organization. It can't just be checking a box to meet a measure.
Right.
We have to change the way that we deliver care so that we can increase the health of our population.
Agreed.
So, Doctor, do you want to take this? Do patients really need telemedicine? What are the new technology around that?
Well, I think absolutely patients need telemedicine, and it goes back to just that previous question about value-based care models and how we're looking at risk and giving patients appropriate care in appropriate settings. Decreasing 5 emergency department visits for a patient who has a very low acuity visit is appropriate use of resources. And so when we're looking at emergency medicine visits versus urgent care, virtual care, et cetera, we have to think about what's the best way to give a patient care with the resources that we have. And so telemedicine certainly falls into that category. On top of that, what patients want, and what patients want is what patients need. And so when we're getting back again to providing care for patients when they want it, where they want it, and how they want it, telemedicine is the solution to that need. So absolutely. And new technologies, I think we've talked about that today. We're developing platforms, we're expanding them, we're making them better, faster, stronger, more user-friendly. That's key. So, and then of course, some of the technological tools that are being developed. I think all of those things are things we've talked about today, some of the new technologies.
Thank you. So I think we'll go through one last question before we go for a very quick closing remarks. So when we are adapting to this, do you see that there is any miss in the adaptation of the technology, right, in deploying any other new technologies? I think we can start with Jennifer. Let's go with you, and then we can go around.
Yeah, so I hope I've shared enough today so that the listeners feel a theme with the message that I'm trying to relay. One of the issues with deploying new technology is deploying it without building it with co-design principles. I'm a professor of healthcare information, informatics and technology. In my class, I walk the students through the history and evolution of the healthcare technology. And in the beginning, just using the EMR as an example, it was built without the physicians and clinicians in mind. And I think that we've gotten a lot better, but are we including the patient in the development now? And that's the first question that I ask any digital or tech solution vendor who wants to work with us. When I ask if they use co-design principles, their response is typically yes with the care team, but very few share that they intentionally designed it with patients at the table. And it had to be designed with patients who've recently had a visit so that they can relate to it. And if it hasn't been tested with patients, then it's a non-starter for us.
Thanks, Jennifer. Doctor?
I think that the key to remember is that even today in all of our technologically advanced world, the clinician-patient interaction is still a human-human interaction, and we still have to make sure that we don't miss on that and that we continue to have the empathy and the care for our patients to give them that experience, because there's so much that is obtained from the patient by having a human-to-human interaction that can never be replaced by technology. So we want to make sure that we keep that as part of our healthcare delivery model.
Thank you. Mark?
Well, I think everybody on the panel would agree. It really comes down to, we can't lose sight of what healthcare is all about. It's patient first. In the technology world, sometimes great solutions are developed. They think about a challenge, a use case that needs to be solved, and they rally around that. We have certainly a lot of venture capital poured into healthcare and technology. It's over the last few years slowing down a little bit, but it's still a massive target. But what we have to keep in mind is the patient and then the provider, and you have to keep in mind workflows and the administrators. I mean, that's the equation to make this thing work. So when you're developing a solution, a digital solution, and placing it into healthcare, you really have to make it seamless. You can't increase workflow to the providers. We can't stress the providers out any more than they've been stressed out. We have a lot leaving the industry, which we can't afford to have these great minds leave. So I think technology solutions need to be a solution that solves the problem, keeping the patient up front in mind and not forgetting about what kind of burden this place will change workflows within the healthcare providers and administrators as well, because we got to make this efficient and streamline it. And a lot of times technologies are disparate. They don't work well together. I think we're going to see some of that change. We're going to see tremendous consolidation because there's so many people attracted to the industry right now. There's so many apps. There's so many platforms. We're going to see continued consolidation, but I think technology really has to keep in mind patient first and provider.
Thanks, Mark. I think we'll go through the closing comments, so we can begin with Dr.
Thank you. I just want to thank the organization today for allowing us to be here and talk about this very important topic. Often when we think about technology, we don't think about the patient experience. And so I'm glad that we're bringing it to the forefront because, like I said, it is the most important part of giving care is the patient experience and making sure that we're giving patients a good experience. Telemedicine, as I said, is definitely the wave of the future. I see it expanding in so many ways and so many specialties, and it's going to really tie our healthcare value-based model together to provide patients, the care, like I said, when they want it, where they want it, and how they want it. But it must always be high quality, great patient experience, great clinicians, and again, that human-to-human interaction. So thanks again for everybody for allowing me to be here. Really appreciate the opportunity.
Thank you, Dr. Jennifer.
Yeah, I too greatly appreciate the opportunity. When we think about digital and technology solutions, really keeping in mind the co-design principles, it needs to work for all who touch it, and using that bias lens so that we can ensure that every patient has a positive outcome. Again, I appreciate the opportunity and thank you for your time today.
Thank you, Jennifer. Mark?
Yeah, Donna, thank you for the time today. I enjoyed the panel and their informative viewpoints on healthcare and where we're headed today. I'd like to close on that as we consider technology and consumerism. I think we also need to keep in mind that there's vast underserved areas, rural and urban areas, that have challenge to accessing healthcare, and they're going to require targeted programs to reach out. We've talked a lot about technology. There's been some mention about affordability of that technology as we move forward, the gap that's being created. I think we really keep that in mind because we still haven't closed the gap in rural areas. There's issues there in urban areas. There's issues there in the underserved areas in both. Challenging to even access health. I think, to make that connection and bring those underserved areas into the ecosystem, I think we really need to focus on that. Again, thanks for the time today. I appreciate the panel discussion and the audience.
Thank you very much, Mark. I totally agree with all of the speakers. I think the times are really exciting. There are real challenges, and the good thing is technology is here. And it has been applied in all other industries. I think there's a lot to learn from the others and then at least accelerate the adaptation to the healthcare. It has been always a laggard, if you really see, and it is picking up. And hopefully, even from the regulations perspective, some of the things will move faster and we will have much more patient-centric access to all these technologies so that the experience can be much better. I really enjoyed speaking to all of you, all the speakers. Thank you so much. I'm handing it over to you, Nitin.
Thank you, Dada. Thank you. It was an amazing panel discussion, and thanks, Dr. Samaniego, Jennifer, Mark, for making it so exciting and so helpful for the audience. I'm sure that they must have taken lot of things from, actually not some, but a lot of things from this great panel discussion. So just to wrap up, we would like to thank our community partners, speakers, and attendees who came together for enriching knowledge through this forum. As we know, we had a great set of panel speakers who came together to share thoughts. Just for your information, today's event was broadcasted in the YouTube and Facebook page of our company, so you all can go and see the recording anytime. Please log on to our website and like the social media channels. We'll be sharing lots of knowledge sharing topics, details, announcement of next events, and much more, which will help you register and attend the same. Also, we'd like to thank InfoVision, which is our knowledge and innovation partner, and Digit7, who's a technology partner. Digit7 also have a great innovation lab of 15,000 square feet in Richardson, Texas. Any one of you who are dropping by can always go to the office and have a look to feel how the technology is changing. To understand more in depth, connect with them, and to suggest any aspect, all of you can go through their website, which is infovision.com and digit7.io, and closely liaison with them. Further, there are lots more in store for next month with focus on banking, financial insurance, telecom, retail, healthcare, supply chain, manufacturing, energy utility, and so on. So request all of you to keep connected with us and enjoy the learning. Thanks, and do take good care of yourself. Have a lovely day and weekend ahead. Bye.
Thank you.
Thank you.